I basically know what they do.
Hi everyone, and thanks for joining us this afternoon for this webinar. I'm Alicia Chenault, UHCAN Ohio's Communication Manager, and will be moderating and offering technical support for today's webinar. This webinar is intended for our coalition members and is the first in what we hope to be a regular series of webinars to help understand MyCare Ohio and to build the capacity of enrollees, families, caregivers of enrollees, and advocates to advocate for better care in MyCare Ohio. The purpose of today's webinar is to get us thinking about how we can engage duly eligible enrollees in MyCare Ohio as advocates and leaders in the efforts to shape MyCare Ohio. So before we kick things off, we're going to go through just a couple technical details. Here you'll see a screenshot of your GoToWebinar toolbar. First you'll see a little red arrow that expands and minimizes the toolbar. If you don't see the toolbar and you see the little red arrow, click that and it will expand the toolbar so you can control your audio settings and ask questions or give any comments you have. Below you'll see a green button that mutes and unmutes your mic on your computer if you'd like to ask a question at the end of the webinar but will be using your microphone on your computer. Make sure you have yourself unmuted. The button with the little hand allows you to raise your hand. It will let me know that you have a question. If you raise your hand, I'll send you a private message to check in with you before I unmute you to speak. Under those buttons, you'll see the audio settings. Select telephone if you'd like to listen and interact with us over the phone. Once you select the telephone option, it will provide you with the phone number, access code, and audio PIN, which allows you to ask questions live over the phone at the end of the webinar. And if you're having any sound trouble, use the telephone for the best connection. You can also select the mic and speakers, which allow you to listen to this webinar over the computer. If you'd like to ask questions via the chat box, there's no need to have a mic. But if you'd like to ask some questions live over the webinar, you'll need your mic or to call in using your phone. And really the last and most important box is the questions box. You can enter any questions or comments you have during the webinar. We'd like to keep this engaging, so please submit anything throughout the webinar. And I'll keep track of them and make sure we get as many questions answered as possible towards the end. So before I turn it over to Kathy to introduce what's going on, submit questions in the question box. We'll have an opportunity to answer them live over the phone, or I can ask the question to the presenters at the end. A copy of this PowerPoint will be available following the webinar, and we'll have it posted up on our website later today too. And this webinar is being recorded, and in order to foster an engaging and safe discussion environment, this is a closed call, and any statements made should be considered off the record. So just to give you an introduction to our speakers today, you'll be hearing from Kathy Levine, Executive Director of UHCAN Ohio, who is helping to coordinate Ohio Consumer Voice for Integrated Care. You'll also be hearing from John Arnold. He is Project Coordinator for Ohio Consumer Voice for Integrated Care. And then we have a great panel of speakers as well. We've got Lena Sharma from Voices for Better Health from Community Catalyst. We also have William Dean from Community Catalyst as well, Deborah Nebel from LEAP up in Cleveland, and also Samantha Brooks from the Benjamin Rose Institute on Aging. So with that, we will open it up to Kathy to give a little introduction into Ohio Consumers for Integrated Care. Kathy?
Now you can hear me?
I can hear you.
Ah, I unmuted myself. Okay, everyone. Hi, it's me, Kathy. Before we begin, I'd like to clarify what we at UHCAN Ohio mean by consumer engagement. It's widely understood in healthcare reform circles that consumers need to be engaged as active participants in their own health care and long-term care needs in order to achieve better health outcomes and lower costs. I mean, there's a consumer engagement subcommittee of the Patient-Centered Medical Home Initiative. Engaging consumers as partners in your own care, however, is just one level of consumer engagement. We believe that consumers have to be actively engaged as participants in the MyCare Ohio managed care plans, quality improvement, and governance. And consumers have to be involved in advocacy with the state and federal regulators around MyCare Ohio and other health reform initiatives. With that said, I'd like to turn it over to Lena Sharma and Bill Dean. They're going to discuss what consumer engagement looks like at the managed care plan level, how to successfully engage consumers in the managed care plan's work, and where consumers can improve how the plans operate.
Great. Thanks, Kathy. Can everyone hear me okay?
Yep.
Perfect. So thank you so much for having Community Catalyst on this call. As Kathy said, my name is Lena Sharma. I'm the State Advocacy Manager for the Voices for Better Health project at Community Catalyst. And before I dive into my portion of the presentation, just wanted to share, for those who may not know, just a little bit about Community Catalyst. In the next slide, we are a national health advocacy organization based in Boston, and we provide support to state and local consumer advocates, state policymakers, and foundations to build consumer advocacy networks in more than 40 states. And we do this through broad-based issue campaigns where we work to ensure that everyone has equal access to high-quality, affordable health care and that consumers have a say in the decisions that affect them. So in our next slide, here is our agenda for today. First, I just want to talk about the federal guidance on consumer engagement, the lever that we have as advocates that's come from the top, ensuring that beneficiaries' voices are heard, and I'll talk about consumer engagement on 3 levels, the state level, and then my colleague will talk about it on the delivery system level and the provider level, and then ways to make that consumer engagement meaningful. So there was 2 guidance that came out in 2011 and 2012, both state Medicaid directors' letter. First one on the Financial Alignment Initiative, which is what Ohio is pursuing, and then the other on just sort of general integrated care models. And both have sort of stated the importance of having beneficiaries, families, consumer organizations have a voice in design, implementation, and oversight of these new initiatives. So we have, as advocates, a lever to sort of push consumer engagement and the importance of it in specifically for the dual eligible demonstration projects. I want to talk about ensuring that the voices are heard, why consumer engagement is so important, and what it looks like on the state level. So consumer engagement is not only important because CMS says so, but we know that it's also important because meaningful consumer engagement makes a real difference. It improves communication, establishes a meaningful feedback loop between consumers, their caregivers, and the delivery system and providers who care for them. And consumer engagement also lets you know what's working and what's not, so we can correct, expand on promising practices and correct costly problems. So I'll talk about 3 levels of consumer engagement. First, it's feedback between consumers and the state. This occurs on the design and implementation phases, as well as through oversight mechanisms, for example, having an ombudsman program. Secondly, it's feedback between members and the delivery system, or the managed care plan, that can lead to the policy changes that improve access, quality of care, and operational issues. And last but not least, and importantly, it's the feedback between consumers and providers that enhances patients' knowledge, skill, and confidence, and making for a more activated patient, and that's something that my colleague is going to talk about in a few minutes. And then there's the state level engagement that we'll sort of jump into now, and I've laid out just how it's playing out in other states, both in terms of the design phase and the implementation phase of the duals demonstration. So for example, in Michigan, the state is holding quarterly regional open forums, and the coalition, the Voices for Better Health Coalition in Michigan has been on the agenda in the past 2 of the regional forums, and is going to be on the 3rd one that's happening in January. So they're sort of inserting themselves on the state level and bringing consumers to these regional open forums. In Ohio, as we all know, there's the enrollment work group, which it's a work in progress, and it's also going to be now an implementation council. And then in New York, the state holds bi-monthly phone calls with stakeholders, including the Voices for Better Health Coalition in New York, who is part of that and sort of helps to bring other groups to the call. And in Washington and in Massachusetts, each of the advisory teams and the implementation council is comprised of consumers, individuals from community-based organizations, provider and trade organizations, and labor unions. And in Massachusetts, the implementation council is over 50% consumers. And so now I'm going to turn it over to Bill Dean. Bill is the manager of delivery system and consumer engagement at Community Catalyst for Voices for Better Health project. And he's going to talk about engagement on the plan level and the provider level.
Yeah, good afternoon, everyone. Thanks, Lena, for the introduction. So I'm going to talk to you a little bit about plan level, delivery system level, consumer engagement. What's been required at this, by the states in either the MOU or through a contract, and then kind of go a little bit deeper into some examples of consumer engagement at both the delivery system level as well as patient to provider, and then conclude with some real sort of concrete ways to make sure that the consumer engagement that strategies that are implemented at the plan level are meaningful and get the feedback that we really want from consumers, their caregivers, and family members to make their experience better and the health system better overall, so that it can affect the lives of all dually eligible beneficiaries. So let's see, are we at this slide? Yeah. So we're at the delivery system level consumer engagement slide here. So you'll note that there's different requirements that are being required in different states. So in Massachusetts, you've got consumer advisory board is going to be required of all plans, or they could do consumers on their governance board, so as part of their board of directors, and that was in the three-way contract. In New York, you'll see that they're requiring a participant advisory committee. So you'll see the words participant, consumer, member, kind of all taken over for each other, and it just depends on the state. But you're basically talking about enrollees of the plans. So in New York, you had a participant advisory committee required, and as well encouraged representation of participants on the board of directors. So you actually have sort of, instead of an either or, you've kind of got maybe both potentially happening, because there is an encouragement to include members of the plan on the board of directors. In Ohio, Virginia, you've seen the MOU is requiring simply a consumer advisory committee, and the wording in the MOU is that provides input to plans governance board. And in Michigan, we don't really have anything yet in terms of a three-way contract or an MOU, which I hear an MOU is imminent soon. It'll probably be right before Christmas, so we can have a happy holiday and read a few hundred pages of that. But what they have already on the books and on their insurance code is that 1/3 of the governance board has to be consumers. I understand they really struggled with that, and so hopefully they're going to somehow improve upon that, as the duly eligible MOUs and three-way contract comes out of that, and hopefully we can help the advocate community improve that there. Next slide. So you'll see, some examples of delivery system level consumer engagement are kind of in our backyard here in New England, and also on the West Coast there, Inland Empire. So the first one I'll tell you about is Commonwealth Care Alliance. They've had for many years a senior care options program, which is their dually eligible beneficiaries 65 or over, and right now they're starting to enroll the under 65 dual population. And what they're doing, what they already have been doing, is they have 2 consumers on their governing board, as well as they do, regional, local consumer advisory meetings. They're kind of more like member meetings or town hall type meetings. They're not exactly, they're not like an elected board that meets the same people every time period. They're a conglomeration of different folks from different cultural backgrounds and and different languages are spoken, and they really reach out sort of with a a nice cultural competent lens to get the feedback of consumers in terms of what's going well, what's not going well, and to also provide some education along the way. And then they're going to be using those hopefully as a springboard for identifying consumers that they can train as ambassadors and provide some leadership development to them so that they can actually participate at an even higher level of governance. So to get those consumer advisory committees formed where there's sort of regular members attending and participating in sort of a little bit more meaningful structural and strategic goal for the improvement of the plan. In Neighborhood Health Plan of Rhode Island has three functions actually. They have that I think is really great consumer engagement strategies. They've got a member advocate who actually helps consumers navigate the health plan as well as the larger healthcare system within Rhode Island. This member advocate acts as an agent for change when the delivery system is not working and identifies consumers that can get involved at higher levels of consumer engagement. So they're interfacing with consumers all the time, and they're identifying those that they can that they see as having the potential to be advocates for others as well as for themselves. Neighborhood Health Plan also has member advisory committees that meet every other month. They're comprised of consumers, providers, and advocates, so it's kind of a nice balance, and they're basically just talking about what's going well and not so well and offering suggestions for improvement. And then as they identify people through those two levels of engagement, they find folks that really want to make an even bigger difference and kind of meet with what they consider a higher level of their corporate governance. So they have a member satisfaction work group, which is kind of like a subcommittee to their board in that it is members meeting with program heads, program administrators within the health plan, from customer service to pharmacy to care coordination to member service to long-term care services and supports division. And meeting with those program heads, they have consumers and program heads meeting together and talking about quality, improvement issues in a more strategic fashion than sort of a town hall type meeting would. And that information goes directly up to the board of directors. At Inland Empire Health Plan, you've got an interesting way that they've approached things too. They've got a Persons with Disabilities work group that meets every 3 months, provides feedback on member materials as well as experience receiving care. They also discuss a lot of communication needs as well as access needs, because of course access is definitely one of the most important barriers, as well as a way that you can bring people into the healthcare system, make sure that it's delivered to them well, if you focus on the access issues. They have a public, go back again. Yeah, so a couple more things that they have is a public policy participation committee. This is kind of similar to the member satisfaction work group at Neighborhood Health Plan, so it's a mix of department heads as well as members. And then finally, they have an Inland Empire Disabilities Collaborative. This is really an interesting way to engage the community. So this is a collaborative that is comprised of over 500 organizations that serve older adults and persons with disabilities. And they come together regularly to focus on how you can promote equal access and independent living options for these populations. Next slide. So next I want to talk about provider-level consumer engagement. I know that there are other tools out there besides these that I have here. I know that Kathy has probably talked to some folks about Dr. John Lawson's Health Confidence Barometer. I'm just going to talk a little bit about Jeffrey Brenner and the Camden Coalition of Health Providers, as well as Judy Hibbert's Patient Activation Measure and how they're utilizing that at the Minnesota Courage Center's epicenter of engagement. So you might have heard of Jeffrey Brenner, but he identified the high utilizers of healthcare in the Camden, New Jersey area and was able to actively engage patients in their homes by using a care management team comprised of a nurse, social worker, a community health worker, and a health coach. So I think it's really key that he's going out to their homes and engaging them on their turf. This is where they feel the most confident and where they're more maybe willing to engage at a deeper level in terms of how, how they're navigating the healthcare system and what could help them improve their care, their own self-management care, and how they can learn how to manage those chronic conditions that are difficult for them to manage. Another tool, like I said here, is Judy Hibbard's patient activation measure. So this is measures a person's self-concept as a manager of his or her own health and healthcare. It's been proved reliable across different languages, cultures, demographic groups, and health statuses. And in a recent article of Health Affairs, you'll know that people who scored higher on the measure also have more positive healthcare experiences and lower healthcare costs. So one organization that's utilized this measure is the Minnesota Cartage Center's Epicenter of Engagement. And what they did is, when they first see patients, they have them take the patient activation measure. And then staff uses that score to modify their interventions. So for example, patients with lower scores may be encouraged to come in more frequently to the clinic, while patients with higher scores may receive interventions more in line with their higher degree of activation. So they might get a home testing kit for if they have frequent urinary tract infections, which is a common cause of hospitalization. So you can see that as the activation measure is lower or higher, there's going to be different ways to engage that person in their own health care and help them get the results that we need them to get, which is better health and lower costs. So next slide. So what are some ways that we can make consumer engagement meaningful? I'll give you some basic guiding principles. So one of the ways that we look at consumer engagement here at Community Catalyst, and I know other organizations see this as a way to do it as well, is to have the ladder of engagement. So you engage members sort of the lower rung of the ladder, which is kind of newsletters and surveys and comment cards, and you get input and feedback from folks at that level. You can get a lot more people using those strategies, but then through those strategies, you can hopefully identify folks that you might want to engage at the next rung up. So you might identify folks who send in surveys or comment cards who you really can sense from their feedback that they might really want to get involved in a focus group. So you want to go to that next level, or have them speak at resource fairs, or make sure that they're invited to a member meeting that is going to talk about some issues and get their live, on the fly feedback rather than something that is, handwritten, or maybe they call in from a hotline from a newsletter. And then through the second layer there, you got the feedback that you're getting from folks and the people that you're identifying in those venues. You might identify folks who would be really great at serving on the board of directors, serving on an advisory committee, or maybe participating on some subcommittee of the board. Next slide. So what, when you're recruiting, you need to use a representative recruitment process. You've got to make sure that you've got a nice balance of the folks that are part of the dual eligible population, and that population is, certainly just like the rest of our folks in the world. We're all very different, we're very diverse, and we have diverse needs and diverse backgrounds and experiences that affect our healthcare decision making and how we're going to get healthy over the long term. So you've got to be looking at age and gender, you've got to be looking at race and ethnicity, language barriers, etc. And you've got to be looking at the socioeconomic factors that factor into people's healthcare decision making and their overall health. You also need to look at, are they in an urban area or are they in a rural area? So you got to look at geographic region, the medical condition or disability type of is also quite varying for folks, and then the services that they're using. Are they using a lot of transportation? Are they in long-term care? Do they have a lot of durable medical equipment use? And so you want to make sure that you get a nice representative grouping of folks so you can really get a nice, rich, diverse feedback for the plan, so that you can get information for all levels of care. Next slide. So if you would delve a little deeper, you're gonna look at there's some specific and real barriers to participation in consumer engagement, and so you're not just looking at demographics and non-demographic data. What you're looking at the sort of the real barriers that are going to keep people from participating. We want to make sure that we eliminate those barriers so that they can participate fully in a consumer engagement strategy of a health plan. So folks have transportation needs. We've got to make sure that we have locations that are convenient to consumers, and you provide transportation. You've got to make sure that your consumer engagement activities are in locations that are physically accessible, that room arrangements are compatible with assistive technology, and that locations are accessible to folks with physical disabilities who may be using a wheelchair or something similar. Another barrier is, could be a language barrier, or could be, that they're visually impaired or hearing impaired. So you've got to make sure that there are interpreters at your meeting so that folks can communicate well. You also have an income barrier for folks. So if you can incentivize folks to participate by giving them a stipend or by providing a meal at an event, that might offset what costs it's taken for them to be there, as well as to let them know that you really value their input in a way that you're willing to compensate for it. There are time barriers. So, folks have different schedules. I mean, there's going to be people who work part-time, who go to bed early, who, there's a lot of things. So you have to be considerate of whether or not you might want to have consumer advisory committee meetings or member meetings in the morning or in the evening. We've seen different examples of each based upon the population that they're trying to garner feedback from. And finally, different levels of engagement require more complex understanding of some really, difficult sort of jargony healthcare terminology. And so you're going to have to, make sure that you're training consumers to understand the information that's going to be talked about at a given meeting, and there's an ongoing sort of leadership development that's going to be needed to make sure that they can continue to increase their capacity to learn, as well as participate fully in the consumer engagement strategies of the plan. So thank you very much for listening to Lena and I. We're happy to answer any questions that you might have for us. There's our email addresses and our telephone numbers, and thank you again.
Great, thanks Bill and Lena. We're going to turn it over to John, who's going to talk about the role of Ohio Consumer Voice for Integrated Care in building consumer engagement at the managed care plan and regulatory levels. John?
All right. Thank you, Lisa. Thank you, Bill and Lena. Before I get started, I do want to remind everyone, please, if you have questions, please submit them to us. Now, I'm going to be focusing on 3 areas. I'm going to be talking about the purpose of Ohio Consumer Voice for Integrated Care, OCVIC, and if it's okay with everyone, going forward, I will refer to it as OCVIC versus the whole name. Now, why we need MyCare Ohio and why the consumer's voice matters. So the purpose of OCVIC is really twofold: to build a voice for consumers and promote best practices for enrollees in the MyCare Ohio demonstration, and to identify consumers who want to become advocates serving on the plan's Consumer Advisory Council. Now, I think it is important, at least at this juncture, to make a distinction, because there's some confusion out there even among our coalition members. OCVIC is directed at creating an ongoing grassroots coalition of consumers who will be trained, empowered, and act as advocates for not only themselves but for others. organizations like the AAAs and the SEALs, they have received funding to provide MyCare Ohio information to consumers and providers to provide prior to implementation. So I do think that it is necessary and important that I do make that distinction, OCFIC's work versus what's going on with the AAAs and the SEALs. Okay. This is what we have now, and you may have experienced some of these problems or issues. So this is what we mean, or I mean, when I say we have a crisis in quality. Now, you don't get help. You don't get the help you need. You get the wrong treatment or unnecessary treatment because no one is coordinating your care, which results into this crisis of quality that we're currently speaking of. Now, it may cost some money to change our healthcare system, but if we don't make changes in our healthcare system, there's going to be many significant costs of inactions, which could result in duplication of tests and procedures, needless hospitalizations, incorrectly prescribed medicines, preventable medical errors, and inadequate information, support, and follow-up. So that is why it's extremely important that we do change this healthcare system. Okay, so as advocates, we must stay on top of this demonstration so that, because these are some of the promises of MyCare Ohio, but we have to ensure as advocates that we get this for all of our consumers. Single point of contact, single ID card, nurse advice line, and more importantly, a care team which consists of your family, doctor, care coordinator, your health plan, and anyone else that you choose to be a part of your care team. All right, this is near and dear to my heart as a caregiver, and understanding what was going on with both my parents and with myself as a caregiver. Why your voice matter. Who else knows what you need, what works for you, what doesn't work in your health care, and who can speak about what the experiences that you're currently experiencing and what you want. No one but you. Okay, this as a advocate and as there is a requirement by the MOU for the state, and it establishes that there should be a consumer advisory council, as Bill and Lena just spoke to. It must reflect the diversity of MyCare Ohio population. Also, it must include participation of individuals with disabilities. So it is a requirement for consumers to be part of this planned project. Okay. Now, in terms of targeted outreach for both the Central Ohio team and the Southwest Ohio team, we have done some targeted outreach. Specifically, we have presented at various forums, been an exhibitor. We have attended and participated in senior roundtables. Also, we have reached out to some organizations such as the Alzheimer's Association, the Brain Injury Association. Also, currently, we are working with a couple of organizations here in Columbus that has a huge senior population, one being the Columbus Metropolitan Housing Authority. I have presented at the residential council meetings. Also, the Neighborhood House will be presenting at their site coordinating meetings. And we're currently trying to reach out to the national church residents, which has a huge duals population that we would like to work with during this demonstration. Okay, now if I was up in Cleveland right now with the team, I would ask everyone there, if I was sitting in front of them or standing in front of them, to raise their hands, because this is how it begins here. And just think about, as I go through this list quickly, your experiences. You know, if you felt rushed through an appointment, you know, Medicare and Medicaid cannot decide who pays. You know, no one is listening to you. Repeated emergency room or hospital visits. Have had a difficult time reaching the right person on the phone. And, you know, is there the proper equipment there to examine you? Okay, currently some of the strategies that we're working on here in Central Ohio. One is with the CMHA, which is the Columbus Metropolitan Housing Authority, have or will establish monthly meetings there with the CMHA to talk about the experiences with MyCare Ohio. And we're going to build advocacy skills of the participants, such as writing letters, attending meetings, and this also will come with a training component. Now, at the end of the day, what we are asking them to do is give us input, you know, what their experiences are so far with the MyCare Ohio. And from a logistical standpoint, we're establishing a location on the east side of town, the west side of town, and also currently looking at areas on the south and the north, just to make it easier for consumers to attend the meetings and have a voice in the process. So what can you do for yourself and for all of us is become a consumer advocate. You know, if you know of someone as well as yourself that can be an advocate and speak to what is currently going on with their care or the lack thereof, we would like to hear from you. We would like for you to join us. Identify and help recruit Medicare and Medicaid eligible people within the regions and provide feedback as well. So next, I'll turn it over to Deborah Nebel and Samantha Brooks to talk about their work in Northeast Ohio Coalition.
Am I unmuted? Hello?
Yep, we can hear you. Go ahead.
You can hear me?
Yep.
Okay. We apologize. In the middle of John's presentation, we basically lost the signal, and we're not getting the webinar anymore. So we're trying to get the webinar back up. So if you will describe the picture that's there, we can go on. I don't have the slides in front of me. So this is Deborah Nebel, and I am the Director of Public Policy for LEAP, Linking Employment, Abilities, and Potential. And my colleague here, Samantha Brooks, is from the Benjamin Rose Institute. And we have been working together. We just got it up. So let's see if we can get the projector back up. Give us 1 second.
Give us 1 second.
Give us 1 second.
Okay. Wow. Muted? Can you still hear us?
Yep, we can hear you.
Okay, we are very sorry. We now have the pictures up, so we can be talking. Okay. The Northeast Ohio. See, here's the problem. I keep hearing myself. You have to mute that. But then she won't hear me.
Deborah, the problem is that you're on speakerphone, and the speakerphone is on too loud. This whole technology wasn't set up for you to be on speakerphone with a group. So try turning down your speaker while you're doing this. In fact, if you could go from speaker to a headset, well, then people couldn't hear you.
Okay, I'm now on the headset. I'm still getting a double message.
Well,
hello?
Yeah, we can hear you. Why don't you start talking?
Okay, we're still getting a repack, so it's going to be difficult for us to talk over that because we're hearing ourselves talk as we speak with you.
What about, do you still have a speakerphone on in the room?
Well, I just turned it back on because it wasn't making any difference whether...
I don't know. Maybe Alyssa has a suggestion. I'm done. You've exhausted my technological.
Deb, this is Lena. Try to mute your computer, because if you have a speaker going on the computer and then on the phone, that might be another reason why you're hearing yourself.
It actually sounds pretty good on our end, so if you can handle it on your end, it sounds okay here.
I think I lost connection, phone connection.
Yeah, I can still hear you, Kathy.
Or what's going on?
It looks like Deborah, they've muted themselves, so now we can't hear them.
Well, until Deborah fixes it, why don't I just do, can you hear me?
Yeah, we can hear you.
Why don't I just go through her slides until Deborah rejoins us?
Sounds
We've
good.
got a limited time here. So the goals of the Northeast Ohio Coalition goals are, first of all, to identify and recruit people who are duly eligible to join our coalition, to support and educate managed care plan members to understand their rights and responsibilities, and that's very important. Part of what we want to do is to educate people who are enrolled in MyCare Ohio to understand their rights and responsibilities, and then 3, to help these members engage with the plans to provide a consumer voice at the managed care table, and that's what we've been talking about, what every speaker has talked about. So the Northeast Ohio Coalition has done focused outreach. Their invitation language you can see on the screen, because of our advocacy work with persons who are aging and who have a disability. We're working with UHCAN Ohio to organize a local grassroots coalition to promote better consumer involvement in MyCare Ohio, as we believe that many of the people you serve will directly be impacted by this change in the delivery system. We are asking that you join with us to identify individuals that you believe have the potential to be consumer advocates in a governance or advisory capacity with the 3 managed care plans in our region. So in other words, what the Northeast Ohio Coalition is doing is going to the vast array of organizations that advocate on behalf of older adults and people with disabilities, and asking them to identify individuals who might be interested and have the ability to become consumer advocates in a governance or advisory capacity with the different managed care plans. And they're hoping, and they're working with different organizations, a wide array of organizations, to encourage those organizations to identify consumers. And in fact, some of those consumers that they've already identified are in the room today with Deborah in Northeast Ohio, so in Cleveland. So some of the organizations, this is a list of some of the organizations they're working with, and you can see these are key organizations that work with people with disabilities and older adults. So they're going to get a very broad array. You know, it was talked about earlier about needing a diverse sampling of enrollees for effective consumer advisory council by reaching out to groups that serve older adults, people with disabilities, people in their homes, people in nursing homes. You know, they should get a demographically and in terms of health need and long-term care need, very diverse population. Next. And just keep in mind, you know, for those who are thinking about consumer advocacy, the approach that we're using in Central Ohio now has been, although we're asking the advocates at the table to identify people, we're also going out directly to consumers through the Columbus Metropolitan Housing Authority, and we're hoping to work at National Church residents, if we can get in there to talk to consumers there. So we're actually testing out two different methods of consumer engagement, which will be very important for our work in the future. So the Northeast Ohio Coalition came up with, they've been speaking a lot to consumers and advocates, and this is a list of the questions that they've been hearing from people. And these questions are very helpful to know what questions people are asking, because that gives us some idea about what kind of questions we need to address when engaging with, partnering with consumers to make MyCare Ohio better. People are asking, I need to understand how managed care works. What exactly will be different from what I have now in fee-for-service? Who will be there to help me work with the managed care plan to be sure I'm receiving what I need? You know, who's going to help me with medical care? What's the role of the case manager? What's the role of the long-term services and supports coordinator, especially for those under 60? Will I be able to keep my providers? Continuity of care. Will I be able to keep my providers when I get enrolled in MyCare Ohio? For people who are on a waiver, such as Passport, will I still be on Passport? How will I receive my long-term services and supports? What's going to change from what I have now, especially if I like what I have now? What exactly are provider networks? We keep hearing that the different plans have different provider networks. What's a provider network and how do they work? How will I receive my drug coverage? What if I don't choose a plan and get assigned to one? What if I'm in an entirely different network from the one I'm currently using? Next. So these are the kinds of basic questions that folks are asking as we do this outreach. I guess I've done Deborah's, and Deborah, you're not there? So right now I guess I'm turning it over to Alyssa.
Yeah, just feel free to submit some questions, or if you have some comments and you have your microphone on your computer working, or if you called in, just use the raise your hand icon and I can unmute you and we can have a little discussion over the phone.
Uh-oh, we're getting reverb. That must be Deborah and company returning to us.
Yeah, so in the meantime, just submit them either through the questions box, type in your question and I'll attribute the comment to you, or raise your hand and I can unmute your phone. Or if there's anything our speakers would like to say as we get some questions in, feel free to chime in.
Well, I think all of us who presented today want to know whether this is giving people help in understanding how we're going to involve consumers, MyCare Ohio enrollees in the program, and what else do you want to know? What do you think you need to know in order to help enrollees get involved in plan governance? Well,
Deborah just checked in and she said that when they unmute, they get the echo. So
I'm sorry, what? What'd you say?
Deborah checked in and said that when they unmute on their end, that they get the echo.
Oh, yeah.
So they're just going to remain muted.
So Catherine Cook, who's sitting with me, just asked the question. You know, in Deborah's presentation, we went through a whole list of questions that consumers and advocates have been asking about MyCare Ohio. That particularly consumers have been asking, how are we going to get answers to consumers besides one-on-one? I mean, as we talk to consumers, we're doing it. Are there other ways that does anybody have any thoughts? Now, why am I hearing an echo now?
It looks like unmuted themselves.
What?
Deborah in Northeast Ohio unmuted themselves, but they're muted again, so
okay.
You can answer the question.
So anyway, you know, I don't know the answer to the different ways that we need to get answers to people. Oh, Catherine, here, I'm going to put Catherine on and hope I don't click. Catherine just suggested that we should do a Q&A and post it on the website. I think that's a great idea, and I'll talk to Deborah about whether she wants to take a first crack at the answers or wants us to. But that's a good to do. Those are good questions. No, those are great questions.
All right, we got one question, and the question is, where are the 3 regions and how far do they extend?
3 regions. There are 7 regions in MyCare Ohio. We're active in 3 regions. We have networks in 3 regions. The 3 regions in which we have networks are Northeast Ohio, Central Ohio, and Southwest Ohio. And maybe John can get on to tell you what counties are in each of those regions, because I don't have my MyCare Ohio map in front of me.
Okay. Can everyone hear me?
Yes.
All right. So for the Southwest region, it includes these following counties: Butler, Warren, Clinton, Hamilton, and Claremont. That's for the Southwest region. In the Central region, it includes Union, Madison, Delaware, Franklin, Pickaway. In the Northeast region, which is the largest region, which will have approximately 32,000 dual eligible consumers, is Lake, Geauga, I hope I pronounced that right, Cuyahoga.
Geauga.
How's it pronounced?
Geauga.
Geauga, okay. Lorain and Medina are the counties in the Northeast region.
But right now, I mean, I don't know about Northeast Ohio. In Central Ohio, the folks who are at the table are mostly Franklin County based. Catherine, who's with me, did some outreach into Delaware County and found that people up there are pretty clueless and the providers and the senior centers, just don't know a lot about what's going on. So I think one of the things we need to talk about in each region is how we're going to get out to every county in our region. And so that goes on our to-do list.
Yes, QACs are very interested.
And I think I would echo the same sentiment in the Southwest, that there's in those particular, in at least Clinton, Warren, Butler, and Claremont. From the forum that I went to, the educational forum, those folks are clueless about what's happening with MyCare Ohio as well.
And Catherine just suggested that we contact the federally qualified health centers that are serving any of those counties, not, in our major counties, as well as the ones that are major counties, because they're seeing a lot of partners, a lot of people. But there are,
we have the opportunity to be at their seminar in March. We're talking about that right now.
So there, I think with our statewide partners too, they can give us contacts in those counties.
Okay, we got a question from Kat Lyons, and she asked, she would like to know how to approach consumers to be on a board before the demonstration begins.
Kat, you can't, because consumers have to pick what plan they're in before they can be on the board of that plan. What we can do now is to find out whether consumers want to be involved in the governance of whatever plan they join. And it's not too early to start getting consumers to understand the answers to all of the questions that the Northeast Ohio advocates posed. None of the questions are straightforward. There's a lot to know, and there's a lot to know about how managed care works. So now's the time that we can educate people about the demonstration. Then when people select their plans or, heaven forbid, get passively enrolled into them, then we can see about getting them onto specific plans. But we're hoping to talk to more consumers than may be able to join a plan. So even if a consumer doesn't end up getting, more consumers that will be able to be on consumer advisory councils. We'd also like to have consumers who are at the table for our coalition, and being in touch, in communication with the Consumer Advisory Council. So we really need to be educating and learning from people before they're enrolled in plans. That was a long answer, sorry.
We got another question that asks what's happening in Northwest Ohio, because there are several advocates that are interested in that area.
I'm sorry, where?
Northwest Ohio.
Okay, that's in Fulton, Lucas, Wood, and...
Yeah, the Independent Living Center up there is very interested in being involved, as is the Area Agency on Aging. We don't, out of UHCAN Ohio, have the staff capacity to kind of organize a coalition. We'd be happy to work with folks up there. So if you're up there, we'd be happy to work with you to plan regular meetings and get started. So just contact John. If you're from Northwest Ohio, contact John and we'll figure out next steps. We've had our hands full trying to get networks, having coalitions going on in Central Ohio and Southwest Ohio. The folks in Northeast Ohio, I don't know what they drink up there, but they're way ahead of everybody else. But, in Southwest Ohio, meetings have been going on for several months, Central slower.
Well, that's it for questions. If you have any, okay, we got one in. Okay. No, unless anybody has any last-minute questions, we'll probably wrap it up. It's a little after 3. Would any of the presenters like to say any kind of closing words?
Well, I just want to thank everybody who's on the phone, panelists and participants. You know, we've been slogging along here for a while now since we started forming the coalition. I don't think we recognize the impact that we've had. The fact that there is an organized consumer voice. Certainly we know the federal regulators, the state regulators, and the managed care plans know that we're there, know that we're growing in strength, and know that we're not going anywhere. So everybody should rejoice in all the progress we've made, even though for those of us who are deeply involved, we feel like, you know, we haven't started and we just haven't done enough. And but we've really we've made a mark, we've made a difference, and I'm very excited about what we're going to do in 2014. So everybody should have a very restful holiday, enjoy family and friends, and Happy New Year. Anyone else want to add anything?
Thanks, Kath. This is Lena. Just if folks had questions afterwards, so just feel free to email me or Bill about our presentation. You know, it was really what we presented, just what's happening in other states, but coming to the delivery system level stuff and the provider level stuff. You know, as advocates, as a coalition, it's about sort of promoting these best practices when we're going out and talking to the managed care plans in Ohio that are going to be serving this population. That these are the type of tools that they should be using, encouraging their providers to be using to engage their patients, sort of become activated, as well as this is what plans should be doing to set up consumer advisory councils that are not just sort of a, you know, checking off the box, but really making them meaningful and getting valuable input, sort of making them see what, you know, what the shared interest is in having meaningful advisory councils. So, and Happy New Year to everyone.
And thanks to Community Catalyst for all your amazing technical support.
Thank you.
Okay, bye everyone.
Bye-bye.
Just want to thank everybody for joining us today. We will be sending a follow-up email with the PowerPoint and recording of the webinar. And we will be updating the UHCAN Ohio /OCVIC webpage with updates. Feel free to check that out. Please like us on Facebook and follow us on Twitter. Thanks again for being here with us today. This concludes our webinar, and have a great afternoon.